before we get into the weight loss drugs, I want to ask you, what is your definition of a fad diet? What makes it a fad? Because could I argue that the Nutritarian diet, the diet that you named, is a fad?
A fad diet has certain criteria. Number one, they're advocating exclusion of some food or food group without legitimate scientific rationale, and the features of the diet usually result in some long-term harm, not benefit.
Right.
So it's not beneficial, and it usually exclusion of some kind of food group that's not beneficial to exclude, and it's distorted in some way that makes it not beneficial or not sustainable long-term.
Yeah, the long-term piece I think is really key because we were talking about this. I mean, people on keto or carnivore diets see all these wild benefits short-term. And when I tell you about this, it doesn't really surprise you. So it's like what's happening immediately might not be the inner workings of something that's going to affect your overall health long-term, right? So it might not make itself that known that early.
Right. When you smoke cigarettes, you don't get lung cancer after a year of smoking cigarettes.
It could help you like lose weight, do all these
cigarettes
things.
help you lose weight.
Yeah.
Right?
But you might be thinking I'm healthier. But like before you knew cigarettes were bad for you, right? Before like we had all this scientific evidence like you were talking about.
People don't have any idea how long cause and effect takes. Mm-hmm. Let me give you one example that's interesting. One of the major causes of colon cancer is the antibiotics people took in their childhood. And they get colon cancer as an adult.
Wow.
So now I'm saying pediatricians are a major cause of colon, and family doctors, which I'm one, are a major cause of colon cancer because they prescribe antibiotics too easily for viral infections when people were not indicated, or they give them for even bacterial ear infections when people could have recovered naturally without the drug.
I just got
starting
chills.
These drugs early in life, and then you have dermatologists giving young people antibiotics orally for years to reduce acne, which then destines them to have lung cancer or Accutane, which can cause other kinds of cancer. So drugs cause cancer.
Drugs are drugs.
Drugs are drugs.
Like if you're popping a pill, it's not like just going to make you like healthier and better, right?
Yeah, but antibiotics particularly are very dangerous.
And I want to just I want people to know that you're not necessarily like adamantly, vehemently against antibiotics. Like you put me on them for Lyme disease. And I feel like that's one of my favorite part about your doctoring is you have all this education around being a family doctor and you know when it's absolutely vital and necessary. Like I was in trouble. And you say, I really don't want to give you these antibiotics, but obviously you need it in this circumstance.
Right. There are some circumstances where you absolutely need antibiotics, like pneumonia or Lyme disease, for example.
For sure.
However, more than 90% of antibiotic prescriptions are written for reasons that the person did not need them.
So you're telling me like so antibiotics get bacteria. So if ear infection is bacterial, it's not viral, correct? In ear infection?
No, ear infections they're usually mixed, and they could start out, when you're young, they usually start out viral. And then if they get plugging of the ear canal, and then they can develop bacterial infections on top of the viral infection. And very often a doctor will turn a viral ear infection into bacterial ear infections by giving antibiotics that then select out for more harmful bacteria in the body. And the next time the person gets infected, they're more likely to get a bacterial infection because they treated the viral infection with an antibiotic. So what I'm saying is, an infection can be viral or bacterial.
Got it.
They're more serious if they're bacterial. And if the bacterial gets too severe, then an antibiotic is needed. But the body has the ability to prevent bacterial infections in a healthy body and even reverse them without antibiotics when they're moderate amount of bacteria present until they invade tissue.
So it's like antibiotics are a good tool to use in modern medicine, but we just prescribe it, as you said, way too easily. Actually, like eager to prescribe it. I almost feel.
Yes, exactly.
Even don't doctors?
Doctors are eager to prescribe them because they feel like that's what the patients want, and it makes the doctor look like they're valuable and important because they gave the patient something. Mm-hmm. It makes the doctor not feel like he's doing anything.
Rather than saying, "Wait it out, see if it gets better."
You're better off if you did nothing, because antibiotics are really dangerous drugs that cause cancer, and that. Call me back. Let's touch base in a couple of days. If you're still getting worse, your fever's not going down, and it looks like it's consolidating and your person's getting sicker, then we'll start an antibiotic.
Right.
That's not the same thing if a person has meningitis or pneumonia where they can't breathe or have trouble breathing, or pneumonia, the person's really sick. So
right.
That's different. But most of these things, viral. But in any case, doctors know that more than 90% of antibiotics are prescribed inappropriately.
They know this, you think?
Yes, they know that. It's on all the medical literature. It's all the scientific studies. I mean, all the
You're saying it's not ambiguous to figure out. It's not like Dear Detective. It's
no, because there's a lot of
evident.
studies done on it. You read the family practice journals. You read the magazines doctors read. Always discuss studies on how many doctors are prescribing inappropriately.
This reminds me of a conversation I had with my roommate, a couple of years ago, who was in med school. And she's saying, but Jenna, people really want the pill. They really want the medication. And I'm like, but I do feel like it's on the doctor's responsibility to give them the choice.
To talk them out of it, not just to give them a choice. To
Right.
talk them out of it.
Better for their long-term health.
Try to talk them out of it if they're not to take drugs.
Let them know the facts. Like, I feel like we don't even give people education. Like, it's built around, like, I'm the professional, so I'm going to have all this education, and maybe I'll share with you little bits and pieces. Like, a totally different setting. But I remember going to the dentist. Like, some people are so scared of going to the dentist because they have no idea what's going on around them or what they're doing in their mouth. Like, it's very scary when you don't know what's going on. And, like, the same thing when you walk into a doctor's office. Like, I feel like it should start with education and options and know the cause and effect.
Doctors, they don't want to give people the time and education. So like if you come to a doctor's office with high blood pressure, he's not going to explain blood pressure medications increase risk of cancer and can actually increase risk of going into atrial fibrillation or other, but I'd prefer you to change your diet, lose weight and cut out the salt, and you can come back to this. We can control that. We can use it if the blood pressure is urgently or emergently high. We can give you something temporarily.
Right.
But let's see if we can avoid the use of medication. That's not what doctors do.
Right.
When people come in for diabetes, almost anything that brings into a person to a doctor, the doctor should be the educator trying to convince the person why they better off changing their lifestyle that caused the problem so they don't need to take drugs, but they don't.
Right.
And now we have the newest thing is they come to a doctor when they're overweight or obese, and now they get drugs to lose weight.
Right.
And these drugs are more effective than ever before because now the drugs really work to lose weight. So the drugs you lose based on the drug you're using, between 20 pounds a year and 50 pounds a year of weight loss, which is significant. And gastric bypass and lap band placement too, people lose weight. But most often the weight loss and the metabolic benefits from lap band and gastric bypass are not permanent. The body adapts, the stomach stretches out again. And so we're talking here the same thing about these drugs. They're very expensive. They cost about maybe $1,500 a month. But here's the issue.
These drugs cost about $1,500 a month for weight loss.
Yeah.
$1,500 a month to take a drug to make you lose weight.
Correct.
And they work. That's
Yes.
what's so scary.
They work is what this, yeah.
So I'm sure you're getting to this. There has to be a catch. Usually when you take a pill or you want some magic to happen in your body, it's like wreaking havoc inside.
That's the first thing we learn in medical school is all drugs are toxic. The side effects are the effects we do not like, and the effects we like are still the side effects. We're just separating effects into the ones we like and the ones we don't like, but it's all the effects of the drug. And now, besides the side effects and the effects that we like, which is the pharmacologic effects, then the question is, what are the long-term effects? And that might take 10 or 15 or 20 years to really see.
Have we studied the long-term effects of these drugs?
No.
So they're so brand new that we don't know the long-term effects.
Right.
But what you were alluding to is that all drugs have costs, and a lot of them increase our risk of cancer.
That's correct. And there's some of these drugs in this category have already shown increased risk of pancreatic cancer and thyroid cancer. I think it was some of the drugs, but not all of them because they haven't been studied long enough. But the drugs, they delay gastric emptying, so you hold the food in your stomach a long time, makes you feel full, and you don't digest the food.
They delay gastric emptying?
Yes, so it makes it like you get reflux and indigestion, and that's why you don't want to eat.
Because you're feeling the food in your stomach, and it's making you think you're very full, even when it's been hours.
Exactly.
But you're not letting that garbage out, like the detox stuff, right?
Yeah, which is shortening lifespan because you know that when we want to finish digesting because we heal and repair in the non-feeding, non-digesting state.
Right, kind of when you emptied everything out.
When you empty everything out, that's the healing phase of the digestive cycle.
Yeah.
So by keeping the digestive tract busy with less and slowing it down, we're actually aging ourselves more rapidly. And so we're causing, of course, the side effects are nausea and vomiting and constipation and gastroparesis, which means your digestive tract doesn't work. And there are some cases of people that are on these drugs, they're relatively new, that they stop the drug because they can't digest food. They're like vomiting and they can't, and they stop the drug and they still have gastroparesis after stopping it. In some cases, there could be long-term gastroparesis even after they stop the drug.
So when you take this drug, it's losing weight. That's like a good side effect. And then there's bad side effects. And I like how you were saying they're all side effects.
Yeah,
it's just
they're all
fascinating. Yeah.
You know, but here's the thing, is that being obese is really dangerous. And probably the most dangerous, you're putting yourself in a position, overeating food and overeating unhealthy food we know causes heart attacks, cancer, strokes, and dementia, and cuts short your life. So now people are going to argue these drugs may have side effects, but the person just lost 50 pounds. So maybe the side effects of the drug is better than the side effects of staying obese. And they're right. That's how dangerous it is to be overweight. That even with these drugs cause cancer, and even if these drugs are so risky and age you faster, they're still safer than staying overweight, than staying obese.
Wow. So probably...
It's like a person comes in with a blood pressure of 190. It's better to give them a drug than keeping the blood pressure 190, but it's better if they just ate healthy and didn't have to take the drug, because they're both bad things.
Right, like you can do it naturally. You could do it with, coaching, this tool belt, coaching, maybe some counseling if you struggle with food addiction and stuff like that. There are tools to really help you. And for some people, it's really easy to make the switch, and it's great. For some people, it's like the hardest thing in the world, and they really have to work at it, like anything that you work at. But it can be done. We see it all the time at the retreat.
Well, that's because people are become highly educated in the science and the methodology I teach, but we also teach them the methodology and information about food addiction, the psychological change they have to make in their personalities to enjoy eating this way, the fact their taste buds will change. In other words, we instruct them, we hold their hand, we give them support.
There's a lot of coaching.
A lot of coaching. We give them so much information. But among conventional authorities, health authorities and physicians, they see that it's impossible for most people to lose weight. Mm-hmm. We don't see impossible people lose weight because we have a successful methodology that works.
Totally. Yeah, we've seen it work so many times. And this is something that's just so fresh, but I got to do a little intro session for people that do a Nutritarian coaching course where they get their certification in Nutritarian coaching. So there's about 88 people on this Zoom call, and we're all going around and sharing our whys of why we're doing this, and hearing their stories about where they started, how sick they were, and where they are now to successfully coaching other people in the Nutritarian diet. I couldn't imagine the number and the fact that we were all interacting on one call. Yeah. It was just so cool. And I knew it works, but just being in that kind of close-knit community, I'm it works.
Yeah, it's really exciting.
And seeing the people that actually made the change and transform and just do it gave me...
It's so cool. You know what's so cool is that I'm very passionate about what I do.
You don't say.
And I'm seeing that you're getting passionate about what I do because you're seeing the results of the people. You're working with the people, and you're seeing what happens.
Are you having a proud dad moment?
That's cool.
Probably the 5-year-old me, you're I can't believe this is how she turned out.
Yeah, right.
Yeah, I hated doing things that you and mom told me to do. But yeah, it breaks your heart a little bit when you see people struggle and they don't have the enjoyment of eating natural foods. Seeing people sick, it sucks. It's the worst thing to go through that. So if you could help people not have to go through that, what is a better gift? To age slower, take care of their health. So how could you not be passionate about it?
Exactly. And that's the same thing with these drugs. I wouldn't want people to think that they shouldn't take the drug, but there's really a better way.
Yeah.
Because here's the thing. If you stop the drug, the weight's going to all come back. And you're going to stay on the drug the rest of your life. And so if the drug's a temporary solution while you're learning how to eat healthfully and take better care of your health, then why you didn't need it for? Just learn healthfully to take better care of your health and save the $1,500 a month.
Totally.
The risk of cancer possibly, and the risk of aging you faster. It just makes more sense to do the program that I'm teaching and supporting people with. But of course,
it's kind of tricky. Sorry, I just feel like it's tricking your mind into thinking that this is going to set you on the path to good health when it's not really. Sure, you might be a little bit better than being overweight, but at the same time, if you're increasing your risk of cancer, that's not a great thing. Why not go for the great thing?
Because if the person didn't know about the Nutritarian diet, didn't know all the supportive services we offer people to enable them to do it in comfort and love eating it, to succeed, then they've failed one diet after another. They don't want to have surgery. Mm-hmm. And this makes sense for those people because they don't know about my work. Or
they think they can't do it, or they don't want to, or
it's too extreme. They think they're giving up too many foods. They'd rather, so I understand why people are doing the drug. And I'm not saying I wouldn't ever think it's a good idea for some people to take it. Maybe it certainly seems safer than staying 200 pounds overweight. You know what I mean? But it's much better if we could get a hold of them and force them to do our program.
For sure.
You know, like there was a person that came to the retreat, a young woman whose parents forced her to come in. She weighed 380 pounds, and she has dropped out of college because she couldn't concentrate and she wasn't in good health. And she said, no way is she going to follow this. This is not her choice. Her parents are forcing her to be here. But when she was exposed to the learning, the information, all the teachings, she not only lost weight, she loved this and became part of her life, and she succeeded. I'm just bringing it up as an example because if you learn enough about the methodology and the teachings, this does work, even if people don't think they want to do it. And I've had events for years where people bring their husband or bring their wife who doesn't want to do it. They're just coming along for the ride, but they hear the information, they learn enough.
And then they slowly start making changes, and then like in 5 years you check back in and you're like, I thought you weren't going to do it.
Yeah, exactly.
So you're like, I knew you would.
Yeah.
But I will say what I also think is really cool, as you were talking about, like all the things doctors do wrong, there is like a very small amount, and I know they exist because people come into the retreat. I know, like, I've heard of like cardiologists like slipping patients your book and being like, take this, and like cancer patients and being like, you should take a look at this, read, watch Dr. Fuhrman's cancer series. Right. And so there are a few out there, and I'm like, did they not tell? It seems like it's so far few and in between, and they don't tell everyone. I guess maybe if like they think you like show a little interest, it would just be so great to have more education. And we see education all the time. We see education on social media. We see it on the internet. We see it on your website. We see it in physician's office. We see word of mouth. The question is, there's so much education. That's where fad diets come in, and where everyone thinks their diet is the next best thing. And you could post about short-term success stories and this and that, and the research isn't there, and they're posting about it, bringing you a whole new wave of people who think they're on this new fad diet that's really going to make them healthy and fit. Right. And that's what's scary too.
Yeah, it's scary.